I'm delighted to be here today to discuss a topic that impacts millions of lives worldwide: type 1 diabetes. Before we delve into the depths of this condition, let's set the stage and understand why it's so crucial to unravel the mysteries surrounding type 1 diabetes. Firstly, imagine this video as a guiding light, illuminating the path towards understanding and managing type 1 diabetes. From the moment you press play, you embark on a journey of discovery, learning, and empowerment. Now, let's address the elephant in the room. What exactly is type 1 diabetes, and how does it differ from its more commonly known counterpart, type 2? Type 2. Type 1 diabetes is characterized by the pancreas's failure to produce insulin, the hormone crucial for regulating blood sugar levels. This sets it apart from type 2 diabetes, which often involves insulin resistance or insufficient insulin production. Understanding this fundamental difference lays the groundwork for comprehending the nuances of type 1 diabetes. However, our journey doesn't end with mere comprehension. It extends to the realm of coping and thriving in the face of adversity. This brings us to our final point: the importance of understanding and coping with this condition. Type 1 diabetes isn't just a medical diagnosis, it's a daily companion influencing every aspect of life. Yet, armed with knowledge and coping strategies, individuals with type 1 diabetes can navigate this journey with resilience and grace. So, as we embark on this exploration of type 1 diabetes, let us remember the significance of this journey. Let us embrace the opportunity to learn, to empathize, and to empower. Together, we can shine a light on type 1 diabetes and illuminate the path towards a brighter, healthier future. What's type 1 diabetes? Type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin. Insulin is a hormone essential for allowing sugar glucose to enter the body's cells to be used as energy. Without enough insulin, glucose accumulates in the blood, leading to high blood sugar levels, known as hyperglycemia. The main difference between type 1 and type 2 diabetes is the underlying cause of the condition. In type 1 diabetes, the immune system attacks and destroys the beta cells in the pancreas, which are responsible for producing insulin. This is known as an autoimmune reaction. As a result, individuals with type 1 diabetes typically rely on insulin injections to control their blood sugar levels and maintain a healthy life. Type 1 diabetes is usually diagnosed in children, adolescents, and young adults, although it can occur at any age. Common symptoms include excessive thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, and blurred vision. Managing type 1 diabetes involves a combination of monitoring blood glucose levels, administering insulin, maintaining a healthy diet, and engaging in regular physical activity. While there is no cure for type 1 diabetes, good control of blood glucose levels can help prevent long-term complications such as heart disease, nerve damage, kidney problems, and eye issues. It is crucial for individuals with type 1 diabetes to receive adequate medical and educational support to effectively manage their condition and lead a full and active life. Failure of the pancreas to produce insulin, the hormone responsible for regular blood glucose levels. The pancreas is a gland located behind the stomach, and one of its main functions is to produce insulin, a hormone essential for regulating blood glucose sugar levels. In type 1 diabetes, the body's immune system attacks and destroys the beta cells in the pancreas, which are responsible for insulin production. As a result, the pancreas can no longer produce enough insulin, leading to a deficiency of this hormone in the body. Without adequate insulin, the body's cells cannot absorb glucose from the bloodstream for energy. This results in an accumulation of glucose in the blood, causing high blood sugar levels, known as hyperglycemia. The lack of insulin in type 1 diabetes is what distinguishes this condition from type 2 diabetes and other forms of diabetes. While type 2 diabetes often involves insulin resistance when the body cells do not respond properly to insulin, type 1 diabetes is characterized by an absolute deficiency of insulin due to the destruction of insulin-producing cells in the pancreas. Therefore, highlighting the pancreas's failure to produce insulin is essential for understanding the physiological basis of type 1 diabetes and its need for treatment with exogenous external insulin to maintain blood glucose levels within healthy limits. The autoimmune nature of the disease, where the immune system attacks and destroys the pancreas's beta cells. The autoimmune nature of type 1 diabetes is a critical aspect to understand and grasping the underlying cause of the condition. In type 1 diabetes, the body's immune system, which is designed to protect against foreign invaders like bacteria and viruses, mistakenly attacks and destroys the beta cells in the pancreas. Beta cells are responsible for producing insulin, the hormone essential for regulating blood sugar levels. When these cells are attacked and destroyed, the pancreas can no longer produce enough insulin, leading to a deficiency of this crucial hormone. The reasons why the immune system targets the beta cells in type 1 diabetes are not entirely clear, but it is believed to involve a combination of genetic predisposition and environmental factors. Certain genes may make individuals more susceptible to developing type 1 diabetes, while environmental triggers, such as viral infections, may also play a role in triggering the autoimmune response. Understanding the autoimmune nature of type 1 diabetes highlights the complexity of the condition and underscores the importance of immune-modulating therapies in its treatment and management. While insulin therapy remains the cornerstone of treatment for type 1 diabetes, ongoing research into immunotherapies aimed at preserving or restoring beta cell function offers hope for future treatments that may one day prevent or reverse the autoimmune destruction of the pancreas in individuals with type 1 diabetes. Symptoms and diagnosis. Symptoms. Symptoms of type 1 diabetes can develop rapidly and may include excessive thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, and blurred vision. Excessive thirst occurs due to the body's need to eliminate excess glucose in the blood through urine, leading to dehydration. Frequent urination is a response to increased urine production as the body tries to rid itself of excess glucose. Extreme hunger occurs because, despite increased food intake, the body's cells cannot efficiently absorb glucose for energy. Unexplained weight loss occurs due to the breakdown of fat and muscle for energy, as cells cannot use glucose effectively. Fatigue is caused by cells being unable to obtain the energy they need despite elevated blood glucose. Blurred vision can occur due to changes in eye fluids caused by hyperglycemia. Diagnosis. The diagnosis of type 1 diabetes typically involves a combination of clinical symptoms and laboratory tests. Blood tests are used to measure fasting blood glucose levels and after ingestion of a sugary solution. A hemoglobin A1C test may be performed to measure average blood glucose levels over a 2 to 3 month period. Urine tests may be conducted to check for the presence of glucose and ketones in the urine, which can indicate uncontrolled diabetes. Early diagnosis is essential to prevent serious complications of type 1 diabetes, such as diabetic ketoacidosis, coma, and even life-threatening conditions. Management and treatment. Management. Managing type 1 diabetes involves a combination of medication, lifestyle adjustments, and regular monitoring to keep blood sugar levels within a healthy range. The cornerstone of management is insulin therapy, which replaces the insulin that the pancreas no longer produces. Insulin can be administered through injections or an insulin pump, which delivers insulin continuously throughout the day. Monitoring blood sugar levels is essential for adjusting insulin doses and preventing complications. This can be done through self-monitoring of blood glucose using a glucose meter, continuous glucose monitoring systems, or periodic lab tests. Following a healthy diet is crucial for managing blood sugar levels. This typically involves monitoring carbohydrate intake, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, and spacing meals evenly throughout the day. Regular exercise physical activity helps improve insulin sensitivity and lower blood sugar levels. Individuals with type 1 diabetes should aim for regular exercise as part of their daily routine. Treatment for type 1 diabetes focuses on controlling blood sugar levels and preventing complications. Insulin therapy is the primary treatment for type 1 diabetes. Different types of insulin may be used, including rapid-acting, short-acting, intermediate-acting, and long-acting insulins, depending on individual needs. Insulin dosages may need to be adjusted based on factors such as diet, exercise, illness, and stress. In addition to insulin therapy, other medications may be prescribed to help manage blood sugar levels, such as oral medications that stimulate insulin production or reduce glucose production by the liver. Close monitoring by a healthcare team, including physicians, diabetes educators, dietitians, and other specialists, is essential for effective treatment and management of type 1 diabetes. Challenges and myths. Challenges. Social stigma. People with type 1 diabetes may face stigma or discrimination due to misconceptions about the condition. This can lead to feelings of isolation, shame, or embarrassment. Dietary restrictions. Managing blood sugar levels often requires careful monitoring of carbohydrate intake, which can be challenging in social situations or when dining out. Constant monitoring. People with type 1 diabetes need to monitor their blood sugar levels regularly, which can be time-consuming and disruptive to daily life. Insulin therapy. Administering insulin multiple times a day or using an insulin pump requires ongoing commitment and can be difficult to manage, especially for children or those with busy lifestyles. Psychological impact. Living with a chronic condition like type 1 diabetes can take a toll on mental health, leading to stress, anxiety, or depression. Myths. Diabetes is caused by eating too much sugar. While diet can affect blood sugar levels, type 1 diabetes is an autoimmune condition caused by genetic and environmental factors, not by consuming too much sugar. People with diabetes can't eat sweets. While moderation is key, people with type 1 diabetes can still enjoy sweets as part of a balanced diet when properly managed with insulin and monitoring. Only overweight people get diabetes. Type 1 diabetes is not related to weight or lifestyle factors and can affect people of any body type or weight. Insulin cures diabetes. While insulin therapy is essential for managing type 1 diabetes, it is not a cure. It helps regulate blood sugar levels but does not address the underlying autoimmune process. People with diabetes can't live a normal life with proper management. People with type 1 diabetes can lead full, active lives and pursue their goals and aspirations like anyone else.